Good morning and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician and Chief Medical Officer of Good Samaritan Physician Network here at Good Samaritan Hospital. I'd like to welcome everybody back to Good Samaritan Facebook Live. I'd like to take just a couple minutes this morning to thank everybody for what a good job they are doing with social distancing. This is a very difficult time for everyone. It's very frustrating, it's very scary, it's anxiety provoking as well. And so I'd like to thank everybody for following the rules and maintaining social distancing. I'd also like to thank everyone who has dealt with the difficulty of not being able to visit the hospital and their family members in the hospital as they typically would. This is a very difficult time for families who have individuals who are sick or in the hospital or in nursing homes or in our rehab facility, because we understand that the importance of that family support is always going to be there, but at this time it's still very difficult to justify some of that with the risk of potentially bringing in COVID-19 or infecting that person or spreading the illness. So I'd like to thank everybody who's dealing with that and appreciate everybody's patience and tolerance. We'll talk a little bit on the show today about how to better deal with some of the anxiety associated with everything that's going on and how to support your family members and friends, because right now it's very important to keep out there and watch out for those people who are high risk, people who are your neighbors and your family and friends who might not have an outlet for food or need support at home. And so we need to keep all those people in mind. So thank you all very much.
Okay, first question that we have this morning is, what is the current state of COVID-19 in our community?
Sure. So the state of COVID-19 in our community is, thus far, the measures that we've been taking have been doing a very good job in limiting any illnesses that we've seen or the spread of the illness. Thus far, we have tests that have come back, and all the tests that have been returned have been negative so far. There are several tests that are still out at the labs, and I'd like to point out that our frustration, along with the public's frustration, in that these tests are not coming back nearly as quickly as we had hoped. Initially, the thought was that the state lab was going to be turning around these tests just within a few hours or maybe a day or two. And our reference labs that we were sending things out to were going to turn things around just in a few days as well. It's turning out that that average turnaround time for the most part is somewhere between 7 and 9 days. We expect to be seeing tests coming back again today as well, but I'm pleased to say that some of the high-risk patients that have already been tested, tests have returned back negative thus far. The other thing to keep in mind that we spoke a little bit about last time is that testing doesn't really change what we're doing. People have questioned the value of the tests, and if we get tests, are we going to be testing everybody? And the answer certainly is no. We still have very limited resources, not just in the testing equipment, but we have limited resources in all the personal protective equipment that people need to wear whenever they're doing that testing. So the approach is still going to be to triage people in the best manner that we can, first over the phone, through our call-in line, and then also through video visits, which will be ramping up this week as well. Those patients that do need to be seen and evaluated will be seen and evaluated out at our convenient care clinic on Willow Street. And if testing for other things turns out negative and the person turns out to be high risk and potentially hospitalized, then testing will be initiated at that time. The tests themselves are supposed to be coming out in more mass over the course of the next few days or so, but unfortunately at this point in time we're still very limited in how many tests we have and how much testing that we can do. The triage process that we put in effect is essentially going to try to separate sick people from otherwise healthy people. All of the medical community is scrambling to cover all of our needs, and for right now our normal acute care visits that would be taken care of at Convenient Care Clinic will be handled over at the Medical Center of Vincennes, which is on 1st Street. So if you have symptoms that are other than respiratory symptoms, you have a broken toe, you have a bloody nose, you think you have an ear infection, something's going on with your blood pressure, your diabetes, or any other primary care needs that are acute, we would like to have those patients directed over to the Medical Center of Vincennes, which is on 1st Street, instead of our normal convenient care on Willow.
And for those people that do have respiratory symptoms and want to utilize that, drive-through triage at Convenient Care Clinic, what are the steps to go through that process?
Sure. The first thing that we would advise people is, if you need to talk to somebody and discuss what your symptoms are and see if you actually need to be evaluated, the best thing to do is call your primary care doctor's office. They will discuss what your symptoms are, and if it sounds like your symptoms have anything related to COVID-19 or that you'll need evaluated, we pass you on through to hopefully some virtual visits or to the triage system that you're alluding to that's out at the Convenient Care Clinic. The phone line is very helpful because a lot of people just need to understand that if their symptoms are relatively mild, cold-like in nature or a mild flu-like in nature, and they're eating, they're drinking, they're sustaining themselves, they're not short of breath, still the best thing to do is to stay at home and self-isolate. Those patients should treat themselves with Tylenol if they have fever, for decongestant and cough medications as needed, and as long as they're sustaining themselves and doing well, this illness will pass within a few days. However, if they have questions about the fact that it seems like their illness is getting worse, they're having increasing symptoms, persisting fever, or most importantly, chest pain or shortness of breath, then they definitely need to be evaluated. Some of the information that we're getting for some of the centers around the country that have seen lots and lots of cases of this so far is that perhaps the most concerning time is about 7 to 8 days out, when patients might develop those more severe symptoms. So if your symptoms are getting better, it's best to stay home and isolate. However, if you're about a week into this illness and it seems like you would expect to be getting better, but you're having shortness of breath or chest pain or any symptoms like that, it's important to get evaluated by somebody in person. And that's where the triage system out at Community Care Clinic is going to come into play. There will be a drive-up system that's in place out there this morning. That's being staffed by our providers. The nurses will initially come out and evaluate you in your car and go through a list of symptoms and determine whether or not it seems like you need to be evaluated. And if you are, that evaluation will occur inside Community Care Clinic, where potential additional testing will be performed to rule out other common illnesses this time of year, which would be influenza, gastroenteritis, sinus infections, allergies, strep throat, those types of things. And that testing will occur on site, including the use of x-ray if needed to rule out any type of pneumonia process that's going on. If it turns out that those patients are deemed to be sick enough to be hospitalized, then we are hoping that those patients will be directly admitted to the hospital, and we're going to try as best we can to avoid sending any type of respiratory patients through the emergency department. Our emergency department needs to continue functioning just like it normally would, even if we didn't have our COVID response going on. So we want to try to direct all patients we can through Community Care Clinic.
Okay, and I think something really important to mention about that Convenient Care Clinic and the drive-through triage is that we really want them to call ahead of time. Don't just show up at the Convenient Care Clinic, but that phone number to call before you go to that respiratory illness clinic is 812-885-3331. And let's just, remind people that it's not a drive-through just to get tested.
Right. And I think that speaks to the issue of testing. We've had a lot of people voice their concerns that they can't just drive up and get tested, and that they could just go to other facilities and get tested. Well, I've spoken with many of our surrounding facilities, and they're basically doing a similar process to we are. We're a little bit ahead of our surrounding community hospitals in how we're handling things in triage, but many of the patients that thought that they could just drive to Evansville and get tested found that they went through a similar process, sat in line, went through the triage process, and were told that they didn't need to be tested. The reason that we're being very restrictive on that right now is that there are a very limited number of tests available, and there's limited amounts of personal protective equipment to do those tests. So if you are ill and it seems like you need to be tested, you will be tested. However, if you have mild symptoms, we're going to instruct you to proceed home with home care instructions.
Okay, and there has been on, a national level, presidents talked about it even, about taking anti-malarial agents and azithromycin.
Sure.
What are your thoughts on that?
So you've heard a lot of things through the news media. Even our national government has spoken a bit to the medications that are potentially available to treat this disease process with. I'd like to start by saying that those medications have been around for a long time, and we've used them for malaria and bronchitis and a variety of other things, but they are very experimental at this point in time. They are being used in some tertiary care facilities and treatment centers, and they are trying to study those to find out if they're appropriate medications, if they're helpful, and most importantly for the rest of us, when those medications should potentially be used. I have with me a list of symptoms, and that list of symptoms is not symptoms of COVID-19. The list of symptoms on here are the side effects of those medications, and they're fairly extensive, ranging from potential blindness, changes in vision, cardiac arrhythmias, fatigue, muscle weakness, cough, congestion, and all of those things are not symptoms of the disease. Those are the side effects of the medication. So if people have mild illness, they certainly do not want to take a medication that's going to make them feel worse than what the mild illness was. So it's important to realize that when you hear about those medications right now are experimental, and we don't really know when they are best to be used. The good news about being in the community that we're in, being in rural America, is that we're doing a very good job of social distancing, and we are seeing a much slower influx of the disease process in our rural communities. There are positive cases in some of our surrounding communities, but there are very few of them. And I can tell you, even though there's not been a lot of testing done here, there are not that many patients that have been presenting with severe respiratory symptoms. So we're doing a very good job of social distancing and slowing the progression of the illness. That does several things for us. The first thing it does is it reduces the exposure to some of our higher risk patients in the area. The other thing it does is it gives us time. So our bigger communities like Chicago, New York, Seattle, places like that saw a huge spike in the number of patients and the severely ill patients 1 week ago, 2 weeks ago, 3 weeks ago. We're having more time on our hands because of the measures that we're taking right now. And what's happening is in some of those tertiary care and treatment facilities, they are now using some of these more experimental treatments, and we will be able to say, hopefully within the next few weeks or so, if those treatments are actually helpful or not. Personally, if I got symptoms, I certainly wouldn't want to take a medication that made me feel worse or put me at risk of other major medical problems. However, if I myself or a family member was sick enough to require some type of experimental treatment, I'm certainly happy that that's going on elsewhere, and we will have more information on that as time passes.
So if someone, is suspected to have COVID-19 or a confirmed case, or even if you just have respiratory illness, like how long should that person be isolated?
Sure, there's been a bit of a change in that recommendation over the course of the past few weeks or so. And initially you would have heard people say that they needed to stay isolated for 14 days. And of late, the recommendation now is from the onset of symptoms, whenever they first get their symptoms, they should be isolated for a week. And they should further be isolated for at least 72 hours after they are fever-free. So the shortest period of time would be that somebody becomes ill, they have fever in the first couple days of their illness, they then become fever-free by, let's say, day 2 or 3, and then they're fever-free through the remainder of that week. That person then is safe to return to whatever their normal exposure would be to other individuals within that week period of time.
And what about those, people that are working that, they're asking about, can I get a note for work saying that I do not have COVID-19?
Sure. So last week in clinic, I saw a few patients that were sent in who were definitely not ill, who were told that they needed to go to their doctor and get a note for work saying that they did not have COVID-19. For all the employers in our area, that's just simply not possible. First of all, we don't want to waste tests on individuals that are not ill. One of the individuals that came and saw me last week had food poisoning, had left a chicken out on the counter overnight and then ate it the next morning and started vomiting. That person definitely does not have COVID-19 and should not be sent to the doctor to be tested. We can tell people that if they are ill and they come in to be seen, that we will give very specific instructions to that patient on when they should return to work. However, there is no such thing right now as a note to return to work certifying that you do not have COVID-19. We have been trying to communicate with all of our local employers so they understand the process and self-isolation, and although it's frustrating to them because they want to protect their employees in their work environment, they need to understand that this is no different than things would have been 2 months ago or 4 months ago when someone came in with influenza. We would give that individual instructions on how long they should isolate themselves at home and when they were safe to return to work, and that policy is still in place now.
Okay, a question on Facebook, if somebody, was tested and has a negative test result, can they come out of quarantine now?
The answer to that is no. So if they have symptoms that are concerning for COVID-19 and the test is negative, the unfortunate thing about the tests that we have, even though they are presumably fairly good, there's somewhere about a 60 to 80% accuracy of those tests. And we look at tests generally that are screening tests, and we hope them to be in the 90+ range as far as their sensitivity for detecting the disease. What we are seeing out of some of the bigger tertiary care centers and treatment facilities is that the tests are not turning out to be that accurate. And so it's important to realize that if you have those illnesses and you test negative, but you still have symptoms that are consistent with COVID-19, we still want you to follow the same precautions as far as isolation as if the test was positive. So that kind of speaks to the fact that we don't want to overuse these tests. We want to use the test to confirm if somebody's positive and rule out all the other potential causes for why they would have those respiratory symptoms. But unfortunately, having a negative test does not clear you from the fact that you don't have COVID-19.
Okay, another question is, I have been on Facebook and read a few articles about not taking ibuprofen, Advil, etc. for fever, that these can possibly worsen the virus. and recommend taking only Tylenol for fever?
Sure. This is an excellent question. Again, there's not a great deal of data on this, but the majority of the data and recommendations have come out of the United Kingdom and Europe. That area of the world generally doesn't recommend taking antipyretics or anti-fever medications anyway, so it's not surprising that that would be an early recommendation. The thought process or the physiology behind it, we believe, is that some of the anti-inflammatory medications, meaning non-steroidal anti-inflammatories, ibuprofen, Aleve, Motrin, Advil, things like this, may interfere with the body's natural process of creating a fever and creating an inflammatory response to kill the virus. At this point in time, my recommendation would be is if you don't feel that bad, don't take any of those medications. If you have a fever and you feel bad and you feel like the fever reduction would make you feel better so you can eat and drink and carry on, then it's important to go ahead and take Tylenol, preferably instead of ibuprofen. There are a variety of herbal type preparations and things that are over the counter that are also touted for their anti-inflammatory effects. We have very little data on any of those things and how they would affect the COVID-19 virus. But I would tell you if you take those type of medications currently for arthritis type symptoms or headaches or things such as that, that temporarily it would be better to discontinue those. So for now, the medications that we recommend most is if you have fever and need a medication, Tylenol would be the first preference, or acetaminophen. If you need medications in terms of things to help out with cough and congestion and mucus control, most of the antihistamine and over-the-counter medications for that are perfectly safe and are okay to use and don't seem to interfere with the body's process of handling the virus.
Can someone have COVID-19, be cleared when it is gone, and contract it again?
We don't know, but the presumption based on what we know about our immune response to almost other types of viruses is we will have immunity long term for this. This has been proven out in our past history of influenza, H1N1 virus, things like that. What we don't know is if seasonally this passes around and comes around again next year, if the virus will be similar enough that our immune systems recognize that. Now, right now they are working on vaccines for this, and they are already in phase 1 trials dealing with those vaccines and even some human trials. The problem is that's not going to happen quickly enough to vaccinate people right now for it. We're going to be seeing that coming out over the course of the next few months or so. And then the main area that that's going to help us in is preventing this as we move further along in the future months. But that's still why social distancing is so important right now, is if we can slow the spread of this illness, it gives us more time to deal with what the best treatment options are, come up with better vaccines for what we have for this illness, and then it also helps us with the resources that are going to be required to take care of some of our sicker patients in the hospital facilities.
Okay, and last question, which is probably a hard one. When will we know when the worst is over?
Sure. The good news is what we spoke about a week ago about flattening the curve and spreading things out over a long period of time is already happening. We know that based on the fact that in rural communities versus large urban areas that we are seeing far less cases and less severe cases and less spread of the illness. And so we are spreading those resources out over a longer period of time. That's what our goal was in the first place. We are still going to see continued cases, we're still going to see transmission, but as of right now, the fact that we have no confirmed cases here and we have a much slower influx of these patients is a good sign that what we're doing is having a positive effect. We're not going to really know how things are going in terms of when we're on the backside of this and when things are improving until we get a few weeks along and we can go back and look at the number of cases in the larger facilities, Chicago, New York, places like that, to say when the spike was, when the majority of the patients have started to drop off in terms of presenting to hospitals to be evaluated, and how things are going with treatment of the more ill patients. So stay tuned and realize that we're not going to have much of that data for a few weeks or so, but also realize that everything that we're doing right now is playing a really important role in keeping the illness progression very slow. I had a question the other day that was a really good one from a patient with regards to their risk of getting the illness versus their risk of getting the complications of the illness. And these are two entirely different things. So what we're doing with social distancing is reducing everyone's risk of contracting the illness. That doesn't necessarily change the fact that some of our higher risk patients still have the risk factors to get a more severe version of the illness. However, the front end, the preventing the transmission of the illness, reduces everybody's risk for contracting that. And I would just emphasize that it's difficult to be patient. It's difficult to stay at home and do nothing. A lot of patients have been on spring break over the course of the past week or so. It's important to realize that coming back into this environment and thinking, well, everything seems relatively calm and we're free to do whatever we want to do, is not the right attitude to have. People need to realize that what's been going on over the past week has been working, and we need to continue with that. So if you have been away from the community and you're returning to the community from spring break, or you've been away for a while, it's important to realize that that social distancing is really very important. Our young people have come back from spring break and they're a little antsy. They're not in school. They don't have as much to do. Learn a foreign language. Learn to play the guitar. I don't care what it is, but find something to do where you're social distancing yourself at home. Social media has been both a blessing and a curse for this entire process. I can tell you that social media helps to comfort a lot of people, but it also makes a lot of people very anxious. It's important to realize that by connecting on social media, you're keeping yourself safe with social distancing. It's also helpful in terms of anxiety and depression and worry, because you realize that everybody else is dealing with very similar things. I spent quite a bit of time on the internet over this weekend answering patients' questions and addressing some social media concerns. And I can tell you that there's a lot of funny stuff out there on the internet, and those types of things are healthy coping mechanisms. We need to realize that people are doing those types of things and submitting videos and singing songs and doing TikToks, which I won't be doing today, to help comfort themselves and others, and that's a healthy coping mechanism. So whereas normally I would tell everybody to put their phones down and drop social media, this is a good time to get together on social media and help comfort each other, and that's what we're all doing right now.
Okay, and just real quick too, we talk about the social distancing. Illinois has a shelter in place. Indiana does not. So whenever Illinois gets out of that shelter in place, there's some concern about a spike in COVID at that time.
Sure. So the thing to keep in mind is if you look at where shelter in place has been initiated, it's typically been in much larger communities. So when we look at New York, when we look at Illinois, cut Illinois off north of Kankakee, and that's the population center of Illinois, it's important to realize that that's why those measures have been put in place in those locations, but geographically that still affects everybody downstate Illinois. The governor of Indiana has addressed this very specifically recently, as this morning, and said that right now there is no shelter in place that's been initiated. They're looking at that every day. They're looking at the spread of the illness. They're looking at the number of cases, and as of yet, that's not been initiated. It's still important for us to hold up our end of things and keep everybody calm and continue with social distancing, but I would have no worries when shelter in place is removed from Illinois that that's going to affect us negatively in any way, especially in our community and our geographic location compared with Chicago.
Okay, I think that is all the time we have with you today, and there are some other questions on Facebook in this thread, so Dr. Stine can respond to some of those here after this broadcast. So we thank you so much for being on here again and helping to educate and inform our community about what's going on.
Sure. Thanks, Tiffany. And I'll be answering questions after I get off online to discuss any other questions that you have. Thank you.